Hello, and welcome back to episode 2 of the Wound Care Micro-Learning Series for nurses. Before we can manage wounds effectively, we need to understand what we're actually healing, and that starts with the skin. In this short lesson, we'll explore the layers of the skin, their functions, and what happens when those layers are injured. So let's get started. The layers of the skin. The skin is the largest organ in the body, and it has 3 main layers, each with a unique role in protection and repair. Number 1 is the epidermis, the outermost layer. It acts as our first line of defense against bacteria, UV light, moisture loss, and it continuously regenerates every 28 to when a wound only affects the epidermis, like a superficial abrasion, it usually heals quickly without scarring. 2, the dermis, which is the middle layer. This is where all the magic happens. It contains collagen and elastin, nerves, sweat glands, and blood vessels that support nutrients and oxygen. When the dermis is damaged, as in a partial thickness wound, healing takes longer. It may require dressing support to maintain moisture balance. 3, subcutaneous tissue. This is the deepest layer made up of fat, connective tissue. It cushions and insulates the body. Full thickness wounds that reach this layer require much more time and energy to repair. Quick tip, whenever you're assessing a wound, think about which layers are exposed. It tells you how serious and what kind of treatment is needed. The function of the skin. The skin is much more than a covering. It's a dynamic organ with several essential functions. Protection, it keeps pathogens out and prevents fluid loss. Sensation, through nerve endings, it lets us feel pain, pressure, and temperature cues that help protect us. Thermoregulation, sweat glands and blood vessels control body temperature. Metabolism produces vitamin D when exposed to sunlight. Excretion removes waste products through sweat. Communication, changes in color, temperature, or texture can signal underlying health issues. When skin integrity is lost, all of these functions are compromised, which is why even the smallest wound can have a big impact, especially in vulnerable patients. How skin heals. When the skin is injured, it goes through 4 overlapping stages of healing. 1, hemostasis. So right after an injury, the body stops the bleeding, platelets form a clot, and fibrin creates a temporary barrier. 2, inflammation. So white blood cells arrive, removing debris and bacteria. That's why wounds often appear red and swollen in the early stages. 3, proliferation. New tissue, called granulation tissue, starts to fill the wound. Collagen forms and new capillaries grow to bring oxygen and nutrient. 4, maturation, or the remodeling phase. Over time, collagen fibers reorganize and the wound gains strength, though the healed area may only regain about 80% of its original strength. The nurse's role is to support these stages by maintaining a moist, clean, protected environment and address any systematic factors that might slow down the process, like poor circulation, diabetes, or malnutrition. So to recap, the epidermis, dermis, and subcutaneous tissues each play a vital role in protection and healing. The skin functions as a complex organ, not just a barrier, but a sensory and immune system. Healing occurs in predictable stages, and our job as nurses is to remove any barriers and support the body's natural repair process. In our next video, we'll build on this foundation and dive into the wound healing process, where you'll learn about what happens at each stage and how to identify when something's gone wrong. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.